Dr. Jim Kearney, a couple things I want to cover with you today. Jim, I know you're back. Welcome back.
Thank you.
Dr. Jim, and you're back at work helping people in the ER. I know that. Okay, now, big story out of San Diego. 16 people dead, 292 hospitalized, 421 infections, all because of a hepatitis A outbreak. So let's talk about how that can happen, why it happened, and the differences between A and hepatitis C, because everybody's confused about that.
Sure. So, I mean, hepatitis A does cause outbreaks, and it has to do with kind of cleanliness, food handling, and things like that. So, you know, if you don't have good sanitation, if you can't wash your hands, if you're homeless and living outdoors and not using normal flushing toilets and everything like that, you're at a higher risk. So, and it's spread by contact. You know, we call it fecal-oral contact, which is kind of gross. But basically, it's shed. The virus is shed in your stool. If you don't wash your hands and you come in contact with something you're going to put in your mouth, like food, then it can get passed on to the next person.
And I'm assuming that's based on the fact that you have this few, but it's the San Diego area. Is this considered a huge outbreak? Is this serious stuff?
Yeah, I mean, we don't. It's been a while since we've seen outbreaks this big. I mean, it's an interesting kind of virus because if you go to places where they don't have vaccines and they have really poor sanitation, every kid gets this before age 10, and kids don't get a lot of symptoms from it. So then they end up with lifelong immunity. It's kind of like the street way to get vaccinated. And then, developing countries like us, or developed countries like us, nobody has been exposed to hepatitis A. So unless you got the vaccine, we get these kind of outbreaks. They usually are easy to control because we have good sanitation. So it kind of walls off the virus from spreading.
All right, so
the homeless population is where it gets tough.
Got it. Once someone has the virus itself, is that fairly easy to deal with? Fairly easy to treat?
Well, the treatment is just supportive care. I mean, the virus runs its course, and 99% of people get better. The problem is when you have alcoholics or people with liver problems, immunocompromised, elderly. Those people can get really taken down, and a small percentage can die from it. So some need to be hospitalized just for supportive care, but almost everyone will survive this.
All right, so the bottom line is use toilet paper, flush your toilet a lot, and wash your hands a whole bunch.
Exactly. That's really all it takes to control it. There was an outbreak, though, in Shanghai like 30 years ago. 300,000 people got it.
Wow. But in terms of the number of people get it and the number of people that die, it's a very small number, isn't it?
Yeah, it's a very small number. And given our kind of sanitation and everything, this should be walled off relatively quickly. Now, it can present, it has like a 2 to 3 week incubation period. So, we may not have seen the end of this yet.
Got it. All right, let's move over to hepatitis C. This is serious stuff, isn't it?
Yeah, hepatitis C is transmitted through the blood. So, and it can live in dried blood for 2 weeks. And so even blood on a countertop or anything is contagious. So we get this from, sharing needles, sharing razors, blood transfusions, tattooing where they don't keep clean, normal tattooing processes in place. And, it doesn't have a lot of symptoms. So what happens is you may get a mild, what looks like hepatitis A, it goes away, and then it lives and damages the liver in a certain percentage of people for a long period of time and puts you at a much higher risk of liver cancer.
And so that one, I'm assuming you've seen hepatitis C a bunch and have seen rarely few or any hepatitis A during your career.
Well, I'd say actually in my career, hepatitis A is more common to be diagnosed in the ER because it's more of an acute illness, where hepatitis C is something you kind of live with, for your whole life. And it's not until it turns into liver cancer that I find it,
Yeah, so I was completely wrong on that. I mixed those two up, didn't I?
But I can't
pretty
tell
much
you which one's more common, to tell you the truth.
Okay, let's do this. I want to leave this topic for a moment and then go in and talk about what you did, because you were in Florida dealing with the aftermath, or maybe even in the middle of Irma. We'll be right back with Dr. Jim Kearney of Remote Area Medical, ramusa.org/CA. All right, Dr. Jim, Robin keeps on wanting me to call you doctor as opposed to Jim, which is okay. Okay, Dr. Jim. That's so dumb. All right.